Hi, my name is Stephanie, and today I'll be inserting an indwelling Foley catheter into a female patient. So I'm just going to start off by reading my prescription. Okay, so my prescription says that doctor has ordered a 12 French 5 cc indwelling catheter into Mrs. Jane Doe, born January 1st, 1939, and she has no known allergies. So I'm just going to gather on my slides. So I have my 12 French Foley catheter. Have my catheterization tray. I have my clean gloves, and I will be using the bag around it as a garbage bag, as my disposable garbage bag. So I'm just going to go into my patient's room, verify that I do have the correct patient, and do an assessment on her just to verify that, again, she is a patient who does need a Foley catheter. So I'm just going to go into my patient's room. Okay. Hi, my name is Stephanie. Can you please tell me your name and date of birth? It's Jane Doe, born January 1st, 1939, and I will check it against her armband. I do have the correct patient. So now, Mrs. Jane, do you have any allergies specifically to latex or to silicone? She says no, and I checked it against her chart, making sure that she has no known allergies. All right, Mrs. Jane, I'm going to be inserting an indwelling catheter. That the doctor's ordered me to insert an indwelling catheter. That's just going to help you urinate because I understand that you've been having difficulty doing so. I've explained the procedure to her. Mrs. Jane, do you need any pain medication? Because this procedure is a little bit uncomfortable. So I've offered her pain medication before we start just to help her relax while we're doing the procedure. She said no, that she's fine, that she wants to go ahead with the procedure. So now I'm just going to start off by performing hand hygiene. I'm going to provide privacy for Mrs. Jane Doe. So I'm going to pull the curtain around. I'm going to drape Mrs. Jane Doe to provide privacy over her perineal area again. And so I'm just going to start out by raising the bed to a comfortable working level to avoid back strain. And I'm going to drape her. So I've draped her. So now I'm just going to perform peri-care before I start, just to clean the area, making it easier to insert the indwelling catheter and avoid any spread of bacteria. So I've cleaned her perineal area, and she's all good to go. So I'm just going to start off by palpating her bladder to look for any distension before I start, just to verify that she is the correct patient and that she does need the Foley catheter. So I'm just going to put on my clean gloves and palpate her bladder. I'm only exposing the area that I need to be exposed. So her bladder is distended, and she does need the Foley catheter. So I'm just going to remove my gloves. I'm going to recover her, and I'm going to open my catheterization tray so I can start my procedure. So I've already had the drainage system. Set up on the other side because I already have the drainage system set up. So I'm just going to start by opening my catheterization tray. So I'm just going to perform hand hygiene again. So I'm just going to open the tray away from my body. Okay, so the tray's open. So now I'm just going to open my catheter and place it into the tray. Placing this into the garbage. So now I'm just going to create my sterile field, making sure that I do not turn my back away from my sterile field. So I'm just going to place my sterile field onto the bed, making sure the shiny side is down, making sure that I can only touch a 1 inch around it. So it asks Mrs. Jane Doe to raise her bum so I can put this sheet under her. So now I'm just going to put the Fester sheet over her. Making sure the shiny side is down. Now I'm only going to expose the area that I need to. And I will fix the area once I put on my sterile gloves. Now put on my sterile gloves. And try and touch the outside. Alright, so my sterile gloves are all good to go. So now I'm just going to start off with placing my tray onto my sterile field. Onto my sterile field, perfect. So now I'm just going to open my iodine swabs. I'm going to lubricate my catheter. Alright, so I'm just going to take out one of my iodine swabs, and I'm going to make sure I use my non-dominant hand to keep the perineal area open while I clean. Making sure my non-dominant hand keeping the area open, and I'm going to clean the area from dirty to clean. So, and then put in the garbage. Gather a new swab. Put in the garbage. Gather a new swab and then clean right down. Alright, so then I've cleaned the area. So now I'm just going to insert my indwelling catheter until I start to see urine or I start to feel resistance. Insert. So now I'm beginning to see resistance. So I will stop inserting the catheter. So now I'm just going to inflate my balloon with 5 cc. So now I'm just going to connect the drainage, making sure that I do not touch the tip because the tip is sterile. Okay, so I have inserted the tip. I'm not sure if you can see. I've inserted the tip and I refrain from touching it. So now I've set up my indwelling catheter, and so now I'm just going to clean up and then assess Mrs. Jane Doe. I will dispose of this into the biohazard bin. Form hand hygiene. Drape Mrs. Jane Doe. And okay, hi Mrs. Jane Doe, how are you feeling? She says she's feeling a lot better. Okay, so here, Mrs. Jane Doe, here's the call bell. If you need me, please call me, and I will come as soon as I can. So now that I've finished, I'm going to go and document on Mrs. Jane Doe. I'm going to document how she tolerated the procedure. If I gave her any pain medication, I'm going to document on the amount of drainage that I do see on my shift, as well as I will document what type of Foley catheter I inserted into it. Thank you, and